The Department of Health has recorded the country's latest MERS-CoV infection after a man from the Middle East has been tested positive of the virus. Joanna tells us why.
The Department of Health has confirmed that a man from Middle East tested positive of MERS coronavirus and is now confined at the Research Institute for Tropical Medicine. According to Health Secretary Janet Garin, news of the 36-year-old man's diagnosis reached them at around 11 o'clock a.m. on Saturday.
May natanggap kaming referral sa Research Institute for Tropical Medicine tungkol sa isang foreigner na may ubo at nanggaling sa Middle East. Bandang alas 5 ng hapon, the test yielded a positive result.
The patient was immediately transferred to RITM and is currently treated in isolation. Initial tests showed that the patient has low viral load, which means only a few amount of MERS coronavirus is in his body, thus a greater chance of recovery. The department tracked 8 individuals who had close contact with a man. 7 of them are now under observation through home quarantine. The other one is in isolation at RITM after catching cold. However, the DOH refused to disclose the identity of the foreigner as well as the date of his arrival in the country. The health agency is currently tracing the other individuals who had personal contact with the man and who might possibly have the symptoms of the infection. Furthermore, the agency reiterates that MERS-CoV is not easily transferred unless through close contact with the infected person.
Ipinapaalala po natin sa publiko na walang documented community transmission ang MERS. Karaniwang nangyayari ang pangahawa sa loob ng hospital. And transmission also occurs via repeated and close contact with a family member or a household companion.
Meanwhile, President Aquino has ordered DOH to intensify stricter surveillance and quarantine measures and to issue prompt reports from hospitals in case a patient show positive symptoms of MERS. Meanwhile, DOH asked Filipinos and foreign nationals who have gone to MERS-affected countries to notify the health department once they have experienced possible symptoms of the infection. Call 711-1001 and 711-1002 or coordinate with cell phone numbers 0922-8841-564, 0920-949-8419, and 0915-772-5621. According to DOH, this is the second case of MERS-CoV ever recorded in the country this year. However, the agency assures the public to keep calm and that all possible measures are being used to treat the said patient. Joanna reporting for Y News.